to talk about the pandemic treaty that will be discussed in May of this year by various countries. In March of 2021, a group of world leaders announced an initiative for a new treaty on pandemic preparedness and response. The 32-page draft, also known as the Zero Draft, proposes mechanisms to prevent and prepare for future pandemics, while ensuring a better coordinated response and equal access to vaccines and treatments and diagnostics. So there is a debate in whether the pandemic treaty is positive or negative. There's also a debate on the wording that is used in the actual paperwork.
And anything happening is a matter of when, not if. So we need to have a placeholder for that, for the disease we don't know that may come. And that was when we gave the name Disease X.
Given his concern, Tedros wants countries worldwide to sign a legally binding agreement full of rules and regulations giving the WHO expanded authority.
The draft agreement is first and foremost a global, political, economic, and social manifesto.
This amounts to a treaty and should be put to a vote in the U.S. Senate.
The WHO refuses to call the pandemic treaty a treaty. It calls it an agreement, an accord, a framework, anything else, likely because it does not want it to be submitted to the treaty process in the United States and worldwide.
Another major sticking point is that approval would allow vaccines, treatments, tests, and other information to be shared.
The One Health approach, it's also a whole society approach. They will have the ability to mobilise every aspect of our society. Once they call those emergencies, they're going to be able to keep them going. They have control of absolutely every aspect of our citizens' life. This is absolutely massive. There's no more important treaty. Of course, if we were to give these sort of powers, which I would never vote for myself, of course we should have a referendum, because sovereignty belongs to the people. It's not ours to give away, and we know that from the referendum we had in 2016. I hope the House listens very carefully and reads these documents.
On May 22nd, the World Health Organization will meet in Geneva to discuss how to best respond to future pandemics. Among the ideas is a U.S. proposed amendment to improve ways of detecting, reporting, and responding to public health events worldwide. Some social media users are referring to this as a pandemic treaty and are using the hashtag #StopTheTreaty to voice their opposition to the amendment. On a podcast hosted by Steve Bannon, former Minnesota Representative Michelle Bachmann claimed the amendment could give the WHO control over the United States. Several Verify viewers emailed us to ask about these claims. So let's verify. Would the pandemic treaty give the WHO control over governments during a global health crisis? Our sources are the International Health Regulations, proposed amendments to the regulations, and the WHO. The International Health Regulations are part of an international law that outlines the responsibilities of WHO member countries, like the U.S., when there's a public health emergency. It requires that countries report what's happening and that the WHO offer assistance. Earlier this year, the U.S. proposed several amendments to the regulations based on what we learned during the COVID-19 pandemic. They include adding early warning criteria, a request to provide genetic sequence data, and outlines a time frame for when and how countries can ask the WHO for support. It does not give the WHO authority over member countries. The amendment repeatedly states that countries can reject the WHO's assistance. So, no, the pandemic treaty would not give the WHO control over governments during a global health crisis. It doesn't give the agency any new authority and only outlines how they can help at the request of a member country. With your Verify, I'm Brandon Lewis.
Is this whole pandemic treaty in our benefit or not? Let me know what you think in the comments. Please subscribe, like, and share.